Hello. Hi, come in. OK. Come in, take a seat. And what's happening with Finley today?
Basically, he's not really quite putting on enough weight. So we went to see the midwife yesterday, and the midwife wanted to just come in just to get you guys to check him out.
OK. Is he breast or wattle feeding?
Breastfeeding.
OK. And then would they just talk to you about having top-up feeds? Or?
Yes, which is what we've started, basically, but they just wanted to make sure that there was no real reason. So he was premature, so he was born at 36.6.
36.6.
And he was only £5.4 when he was born, so obviously he was little anyway.
Yeah. No problems in pregnancy?
Well, I've got polycystic ovaries and I've got biconic uterus, and he was a twin, but we lost the other baby. So, yeah, I suppose it's the answer.
Some quite, yeah, a little bit there. So, OK.
So we kind of knew he was probably going to be small anyway because of the biconic uterus.
Yeah.
We also had a very, very quick labour. It was only 48 minutes. So.
And it just wasn't a plan here. It just happened that he arrived early.
Yeah.
OK.
Just popped out very quickly.
OK. We should have a look. We'll have a look at him. Let's just pop him up on the couch. But no problems with vomiting and...
He's vomiting a little bit, but nothing...
Not projectile.
Nothing that I'm, no more so than anyone else's baby.
Switch that off, then it's not going to get too cold. Oh, hey, chap. Very wee, isn't he? Let's just have a quick look in here. Can you open up for us? Oh, dear. Nice normal feeding fontanelle. Let's just pop him just on here just for a moment, just have a feel of that tummy. Oh, he's so wee. What centile was he on when he was born?
According to because they track it back, don't they?
Yeah.
They put it on so he was on 25.
25, then he went down to 2, now he's gone up to 8.
OK, so that's all good then. That's all right. Let's have a listen to your chest, little man. I can't see any tongue tone there. It was showing us the base of his tongue very well, actually. Oh, dear. You're trying to have a good sleep.
Right, he makes that noise a lot.
We're just upsetting you.
That's just his general noise.
Just very wee, aren't you? So the plan is with bottle top-ups.
Yeah.
And how many a day were they suggesting?
I think they said about 3, but what have we done so far? We've given him 2 so far.
This is why, yeah, he had one there.
Which he takes fine. He's not picky about what he takes at all. He'll just, basically drink whatever you give him. I think
he will drink it all.
Okay. So he was down on the 2nd centile. He's gone up to the 9th. No, but he is gaining weight now. So I would just keep on persevering with what you're doing. You're doing all the right things. And hopefully when they weigh him next week, it has just really gone up.
Yeah.
And we go from there.
Super. Right. Thank you very much.
Thank you. Thank you very much.
Thank you.
Thank you.
Nice weekend.
Aaron speaking. How can I help?
How can I help? Hi. You've been waiting a while. You arrived early.
Yeah.
Oh, okay.
Yeah, I don't mind waiting before.
Okay, that's good.
Oh, man.
So, we talked on the phone a bit.
Yes.
What's been happening?
Oh, man, it's just... For the last 3 months, it's just been really, really stressful for me. I lost my job, and then been getting job seekers. Then for some reason they stopped the job seekers, and it was all to do with my landlord.
Right.
And got in a situation where rent arrears, and then basically she served me with eviction notice.
So how long is it? How long have you got?
I'm supposed to be coming out of there next month on the 15th.
Yeah.
And I go to the job centre, they still want me to still be looking for work.
Yeah.
But I say to them, if you're not giving me no money, how can I look for work? They said, that's the ruling of the government.
Right.
It's just been stress.
So
really stressful.
You got somebody helping you?
Yeah, I've got an MP helping me. She's looking into it.
Good.
Other than that, it's like I'm just going round in circles, spinning around and getting nowhere.
So, and your mood then, do you think it's low all the time? Does it come up and down?
Right now, it's sort of in between.
In between at the moment.
I feel a little bit better because obviously, when you said that I could come in today,
Yeah.
I'm like, it's not a lot of people I want to tell my problems anyway, you know. The thing is, sometimes I can't come down to see you, like, because they stop my job seekers, and I'm thinking, how am I going to get over it?
Yes.
You know, and you know, so
there's the external things that obviously are impacting. It sounds like you're working on that. The other thing that might help you, the two other things. One is where you talk to somebody, a counsellor or something, whether that would help. I think you did that, didn't you? You saw.
Yeah.
That's one thing.
Yeah.
And the other thing is whether tablets, medication might help you.
Yeah, probably. I think I had some stress tablets or something like that.
Yeah, you had something called fluoxetine, I think.
Yeah.
Do you remember back, did it cause you many problems or how was it?
I think it just made me sort of calm down, don't get too worked up about things, you know.
If it helps just calm things, it might be worth starting it again.
It's just... When I was working, it was all right.
So can I just measure that one? Is that okay? Yeah. So it's quite big, isn't it?
Yeah. And how long have you had it for now?
I seem to remember that it sort of fell off and then grew back.
Yeah. Let's have a little look. Okay, so it sort of does look a bit crusty, doesn't it?
No lumps under the armpits, you've noticed? Lumps and bumps in the groin. Everything's great. Okay, have a seat for me.
Well, how can I help?
It's really weird. I've got something wrong with the soles of my feet. They're quite painful, but they're not. I don't think they're verrucas, but they get quite sore, you know.
Okay.
And when I go in like hot water, most of it when I was in a jacuzzi, they're like all these little tiny holes.
Okay.
Sorry, they're a bit dirty.
Okay, so it's all these kind of hard lumps here.
It's all around here, and I noticed they get like it's like my feet smell much more, and they're sticky and sweat, like really, just yucky.
Sure.
Not nice.
So these are kind of wart-like and verruca-like in nature, actually. So our options with these are, A, they're self-limiting, so they will go away eventually by themselves.
Mm-hmm.
But by eventually, I mean on average about 18 months, but can be much sooner, but can also be much later, i.e. kind of 5 years, that kind of time frame. So option number 2 is there are certain over-the-counter treatments that you can use.
So it is like a verruca, isn't it?
You've got a nice cluster of them, that's why.
Oh, that's what it is. So I've got just hundreds of verrucas.
You've got quite a few of them there.
My daughter's had a
They
verruca.
can be.
Is it her fault? I'm going to blame her.
It's possible.
Really?
Yeah.
Oh, killer. I told her she's walking around with it.
Not entirely sure it's her fault, but she got it from someone too.
She got it before I got this.
Well, there you go. You need to blame whoever gave it to her.
That was her other sister.
Oh, no.
So
Your whole family are plagued with them now.
I'm just left with this thing, my
Okay.
foot. All their verrucas have gone.
Well, there you go. So as you know, theirs have gone nicely. Yours may very well go as quickly as theirs did.
So I just do whatever they did.
Yeah.
Verruca treatment.
You know, they are contagious, so try and wear flip-flops and things like that in the shower.
Right, okay.
Or else you'll have an angry wife.
Right.
All right, take care of yourself. No worries. Bye.
These low points when you've obviously had shocks and you felt quite low.
Yeah.
What's the worst thing that's gone through your head when you're that low? Have you had thoughts of harming yourself or doing anything?
Not yet.
Okay,
Not
that's
yet.
good. So one thing I could do, so we'll follow up with that one, family action, but the citizens' advice one, they might be able to give you some advice on the phone.
Yeah.
And they might have a link to somebody, maybe.
Yeah. Any advice is good.
Yeah?
Yeah, especially when it comes from my GP. Yeah.
The recent changes by the government on welfare have definitely had an impact on the NHS. Unfortunately, welfare and health are very interlinked, and therefore any change and impact on social services and welfare is going to impact on the NHS and on GPs.
I was thinking, is it, you know, last time, I think you did a letter for me, basically. They said I got to appeal and all this kind of craziness. I don't know if you could sort of type out a letter or whatever, just to sort of push it forward.
Sure. So I can do a letter of support. I guess in the letter, we'd have to put some information on as to why, what the reason for the letter. So obviously it's depression.
Yeah.
And we're talking about medication and that sort of thing. And that puts you at risk. So we can put that in the letter. Yeah. I chose to write a letter for Mr. Moore to help support his case in terms of with his housing. I think it's debatable as to whether GPs should write a letter such as this. First of all, from the Housing Association's point of view, they don't tend to listen to what a GP may write in a letter. However, on the other side, one of the main roles of a GP is to be the advocate for the patient, and that can definitely help the patient fight their case and get to where they need to get to. So I'll do that letter and I'll pop it in the post to you. Yeah?
Yeah, that's brilliant.
Okay?
Yeah.
You have to stay strong, think practical.
You know what? Like, certain people I can talk to, I mean, certain people, when they ask me how am I getting on, I just, it's like I don't even want to tell them, because if I can't talk to you or anyone in here about it, then who can I talk to?
Yeah.
You know?
Yeah.
Yeah. It's all good.
Okay.
All right, then, thank you.
Keep in touch. Yeah.
Okay.
And see you before that
All right,
finishes.
then, thank you, Dr.
Okay.
Shah.
All right. Bye-bye. See you.
Come in when you can and we'll get you on the system, we'll get your medication sorted. Who's the best doctor? Dr. Watson? Yeah. All the doctors are nice here, all the doctors are nice here.
Mr. Fish. All the way at the bottom of the corridor, I'm afraid. Come in.
Thank you.
Mr. Fish, come and take a seat. How has the chest been since last week?
I've still got the cough, and this morning I did a cough and it really killed me there.
Over on that side.
He did cough up a load of gunk the other day as well. Big load of it on the chest.
Okay. The question is whether or not we should just continue with that antibiotic for a bit longer than we normally would do, because this is the third course of antibiotics, isn't it?
No, this
The third we've just had, then we've
then this will be another week of the same one. So third lot of antibiotics. Hopefully we don't have you sort of bouncing back in like you were last week with the chest being much worse. Let's see what sort of number we're able to get on this today. Mr. Fish is a lifelong heavy smoker who suffers from chronic airways disease, and as a result of that often develops infections on the chest. The device that was placed on his finger was a pulse oximeter, and this gives an estimation of the patient's oxygen saturations at that point in time by looking at how red the blood is in the arteries in the finger. It's better than it was last week. It's better actually than it was when we examined you earlier in the year. It's 93% on here. For patients with a long-standing airways disease, like Mr. Fish, they might normally have a lower oxygen level, around 93, 94%, that if I had right now, I'd feel very short of breath with. Obviously, we've spoken about smoking, and that didn't seem to have much of an effect. But anything that you can do to exercise, to increase the quality of the air movement through the chest is going to be better. So forcing him for this walk to here clearly has done some good. And it might be a case of forcing you to get out and walk some more, exercise some more, and circulate the air around the chest better.
God, I'd love seeing you running around the block.
Yeah, I'm not suggesting taking a marathon running, but a little bit of light exercise is good for anybody. Let's have a listen on the chest today. If we get you standing up, let's have a listen on this chest. That's good. And then just some good breaths in and out through the mouth. That's perfect. And pop yourself back down. Chest sounds much better than it did last time. It sounded quite wet on the left-hand side when we listened the other day. There's still an occasional wheezy sound on that left-hand side of the chest, but it's far better than it was. Okay, and you've been seen in the, the community clinic for the chest, had all the physiotherapy exercises, all those sorts of things for that. You go and see the nurse and they review everything, get you to breathe in all those machines and stuff like that. They obviously will tell you off about the smoking yet again. It can be very frustrating treating patients with chronic diseases who continue to follow the bad habits that have given rise to those conditions. With a patient like Mr. Fish, who's very far through that disease process, making these changes now can be almost impossible. And it just goes to show how important it is to make interventions and changes early on at the diagnosis of these conditions. Keep on soldiering on, Mr. Fish. Okay.
Thank you.
Fantastic. Take care. And I won't routinely see him again next week. If things are getting worse, obviously pop back.
Yeah,
okay. Take care. Take care.
Hello? What's the date of birth, please?
Hello. Hi. Okay, good.
Done with holiday?
Yes, thank you.
I've realised my heart rate is constantly about 85, 86.
Mm-hmm.
It should be really 76, 77, under 80, no? Or
There's
is it
no
more than-
specific rule for it, for heart rate. So
Yeah.
it depends. I mean, one thing it's worth checking, which I was just checking to see if you'd had done, was your thyroid. So if someone is high in the thyroid, then that can increase the heart rate. Other thing that puts up a heart rate is caffeine. So
I have one coffee every morning and that's it.
I think it's just, I wouldn't worry about it. I think your heart rate is a bit higher than other people.
Yeah.
But actually everything else is good.
Yeah.
So otherwise, how are you doing?
I'm doing okay, yes, everything's quite good. I do sometimes go into a dip, but I've learned to detect it. So as soon as that happens, I've got tricks.
How long is it now since you separated?
Well, I left him at 2009, but the whole thing started like 4 years before that.
Yeah.
And then I just couldn't take it anymore after all those years. So it's so funny. Every time I think about it, it's still...
Yeah, no.
makes me
Which is why
upset.
I wanted to bring it up, because it's good for you to...
But it still hurts. I don't know what it is.
No, it's not what...
We were together.
You went through a lot.
We were together for 30 years.
Exactly.
You know, and it's really fine because it hasn't made me so ready for another relationship, because I meet people, but I just can't be bothered.
Not yet. It will happen.
You know?
It will happen. Naturally, time will come and you'll be...
Seriously?
Yes.
We'll see. Yeah, thank you, Dr. Shah.
No problem.
Your support's been amazing lately, so I mean, I don't know what to say, but except for thank you, really.
No, you're welcome.
Dr. Shah, I'm bringing my parents within a week time,
Oh, okay.
so I'm just worried. All right, thank you very much.
All right.
Bye.
Bye-bye. See you.
Good afternoon, Alicia speaking. How can I help?
Hello, you alright?
I'm good, yeah.
Good. Come through.
I'm friendly called Joe anyway.
Joe?
Yeah.
Okay. Hi, Joe. I'm Pa. Nice to meet you.
Nice to meet
I'm
you.
the healthcare assistant here. So I can see here you are down because you want to stop smoking. Is that correct? Okay. So what is it you're smoking?
Tobacco.
Tobacco?
Yeah.
Roll-ups? you think?
Roll-ups, yeah.
Okay. And how much are you getting through
In
in a week?
In a day, I could get through easy about 10 or more, for about 10, 15 in a day or something.
10 roll-ups?
Yeah.
All right. And how long have you been smoking for?
On and off since I was about 15.
Okay. And you're 19, so 4 years.
Yeah.
So, in the 4 years you've been smoking, have you ever stopped? Has there any having periods of you
I've had
stopping?
11 periods of stopping.
11?
Yeah, 11.
Oh.
Yeah, because I used to go to boarding school, so obviously I couldn't smoke there, so I did during the weekend, and then after a while I thought, I'm sorry.
It's all right.
You what, Dad? Yeah, I am. Yeah. Yeah. Can you text it to me? Yeah. Or can you text me to do it so I can remember?
One thing. Could you wake me, please?
Yeah, of course.
Just see. Shall I leave on my shoes?
Whip them off, probably.
I like sweets, chocolate and cakes. You know, that's my thing. I mean, I've been wanting to give it up, but it's so nice.
Sounds like you're eating brilliantly. I'm really impressed, mister, that you're listening and taking on board what Mum and Dad have said. Could you do me a favour?
What?
Would you be able to do me 2 weeks of a food diary? Is that all right?
Yeah.
My personal suggestion would be to try Slimming World, combining it with loads of exercise.
Okay.
Sorry to keep you waiting. I've got John, who's a student nurse, sitting with me today.
Hello.
Is that all right with you?
Yes, of
Yeah,
course.
good. Have a seat. You've had some bloods done for
Yes.
me. That was great. So, you know the 3 monthly average blood sugar, the HbA1c? It's just gone up slightly.
Right.
So I wanted to discuss with you whether you would be happy to start a tablet.
Well, I only take 6 now, so
I know.
when
So-
I'll be lost.
This is up for discussion. There are 2 types of diabetes, type 1 and type 2. Type 1 diabetes tends to be diagnosed in young children and teenagers. Mainly in general practice, we're dealing with people with type 2 diabetes, of which there's a huge explosion at the moment, mainly due to the way people eat and obesity. It can lead to complications such as blindness, kidney failure, heart attacks and strokes, and the commonest cause in this country of amputated limbs, apart from accidents, is diabetes. How have you been getting on with your healthy eating regime? Yes.
Well, the good news is
Oh, yeah.
my diet, my food diet is very healthy.
Right.
As it turns out, as you get older,
Yeah.
cut out the red meats and high fat and whatnot.
Right.
Of course, as far as sugar's concerned,
Yes, sugar is what I'm interested in,
Yes.
man. You were having a lot of sugar in your tea, weren't you?
I've cut out that.
Good, well done.
But as Oscar Wilde said, I can resist everything except temptation, and that's a bit the same with the old biscuits and
Is it?
chocolate.
Is it?
You know, buying out seven bars of Cadbury's Dairy Milk is not good, but I can usually make them last a day. No, it's
Don't
not.
you tell me that.
The problems I have with sugar are quite straightforward. Biscuits, I have a few. Chocolate, the odd cake.
Would you like me to give you a smack now? I think as time goes on, at some point you're going to have to address, it's great we can have a joke about it, but actually you're eating quite a lot of sugar.
Yeah.
And sometimes we go on, we're adding more tablets in all the time to reduce the sugar in your blood, and you're eating all this sugar, so it's a bit illogical. Our first line of treatment is to ask them to cut sugar out of their diet. It sounds quite easy, but for most people this is the hardest thing to do, to change the way they may have eaten for all their adult life. What I want you to do, I don't at all want you not to enjoy yourself or make your life a misery, but the people who do best with their diabetes over a long time are people who sort of take it on board and take some control themselves. Diabetes is a progressive disease normally, so people start off with diet control, then we add in 1 tablet, up the dose, then we add another tablet, and then 10 years down the line you're on insulin.
It was my hope and probably expectation that I'd come today and my sugar level would not have gone up. But if it's gone up, I'm not daft.
No,
It's gone
good.
up.
Great. So what I suggest we do, where are we now? Beginning of July, August, September, October. I'd like to see you at the beginning of October and have some bloods the week before you see me again.
Right.
Is that a deal?
Yeah, sure. It'll be down.
Will it?
It'll be down, I can
I
guarantee.
don't want to hear any excuses.
Although I'm going on holiday. No, it'll be down. It'll be down. It'll be down.
I have heard every excuse in the world from everybody. Then. Okay, I'll just get this signed for you.
Okay,
and
thank you.
That should be it.
Okay, thank
Good.
you. Thanks a lot.
You can come down to the waiting room if you like.
Nice to meet you. Yeah, take care.
Or can you text me to do it so I can remember? Cool. Sorry.
It's all right. So after that month of not smoking, what made you decide to start again?
Like having a few drinks with my friends.
Oh, okay.
So I like smoking a lot when I'm drinking.
All right, so what do you know about quitting smoking? What kind of remedies have you heard of?
Well, I've tried like the herbal cigarettes.
No nicotine replacement?
I've tried like electronic cigarettes and that.
Okay. So what I would suggest is having a patch on and some nicotine spray.
Okay.
Which is just an oral spray and it comes in a little tube like that.
Yeah.
And you spray anytime you get a craving.
Yeah.
You'd spray it in the sides of your mouth.
Okay.
Here. And then plus you'll have the patch on throughout the day.
Yeah.
So you're not just going to be sitting there spraying all day because you've got the patch on. So when do you think that you'd be ready to start using them and then not smoking at all?
Well, I think the best time would be probably next week because that's when I start my course. I'm going to be smoking a lot on my course, so...
There's no hurry. So that would be your quit day. That would be the day where you wake up and you put the patch on and then you'll have no tobacco. Yeah?
Okay, yeah.
Yeah? I'm currently seeing 11 patients and helping them stop smoking over a 12-week period. 11 out of the 11 patients I've seen have quit, but they still do see me for a bit of extra support and to keep them going and motivated. Don't worry, don't be scared, it's good. It's a good thing to do.
So when I'm on it, if I do smoke, would that do anything bad? Or?
Yeah. No, man. It's just...
no, I can see you're joking, yeah.
So, let me do this prescription. I feel that it's a really big achievement for someone to quit smoking and I feel quite proud of myself to know that I've helped them, maybe give them a few extra years on their life. So, the 21st is your quit date, so I'll see you 2 weeks after that.
Yeah.
And what times are good for you?
Any time.
I've got 10:30, I've got 11, I've got 2:20.
For 10:30, yeah.
10:30?
That's 10:30, yeah?
Yeah.
Yeah. I was never good at maths in my school, so...
That's not maths. So honestly, any questions or anything, I work Monday to Friday, just phone up and say, can I speak to Pa? I've got a question, or can you put me through to Pa, whatever, yeah?
Yeah.
Good luck and well done.
Thank you.
We'll get there, all right?
Yeah, we will, yeah.
Take care, Joe.
Thank you. Have a good day.
See ya.
Hi, Dr. Shah.
So I've just come back from Jamaica, and it's not the first time this has happened. When I go, I get these blisters on my feet. Can I show you?
Yes.
And when I'm away, my feet always swell up, and I get, which I think I have been here before, and they've said it's eczema, but I just seem to now just get it when I go on holiday.
Is it always Jamaica, or have you had it in other places?
I've had it in other places.
The heat, do you think, or?
Definitely got something to do with the heat. But when I had eczema first, I was in England.
Oh, okay. And is this a bad flare-up, or
this has actually gone down.
Good?
I thought I need to come because you come back and say, "Oh, my shoulders dropped," and I forget, and I thought I really need to.
When did you come back?
2 weeks.
2 weeks ago.
Yeah.
And is it itchy?
It's itchy.
Pain on pressure, or just pain like this?
This is fine.
It's pressure.
Yeah.
And I can see a bit here. Where's the worst?
It was here.
That was the worst. This one is big.
These ones.
There's something at the bottom as well.
Yeah, and then at the side.
And this side.
Wow.
This is amazing.
Really?
I think I know what it is. It's nothing serious, but it is a horrible condition.
Okay.
It doesn't get worse.
Okay.
You probably got your worst already.
Yeah.
But you do end up with this typical pus-filled blisters, which is what you've got here.
Yeah.
And itch is classic.
Yeah.
The names that they have for this, pustulosis is one, but there is a pustular eczema.
Right.
There's also a pustular psoriasis.
Right.
They're basically the same condition.
Yes.
Some people get it on the hands as well, you can imagine. But in your case, clearly, it's this 1 foot. The other foot...
Yeah, this one seems to be
It's weird why it's 1 foot, but it is quite often just 1 foot.
Okay, so what's the treatment?
Steroid. Strong steroid cream. It's the only treatment. Have you tried it?
No.
Oh, you never had it before?
I think they may have given it to me, but I wouldn't have taken it.
You wouldn't
if
have
they
used
did.
it. So steroid cream has got bad press. So the cream version, obviously, you're not taking it orally. So it only works locally.
Okay.
The steroid is obviously an ointment. It gets absorbed into the skin. Thickness of the skin, particularly on the feet and the hands, is very thick. So that's why we have to use a strong steroid. So if it was somewhere else, you'd absorb it easier, so then we use a milder steroid. In your case, if you know every time you go you're going to get it, the thing you'd want to do is to put that cream on before you land, and then use it whilst you're there, and then you won't get it to this stage.
Right.
That would be the aim.
Thank you so much.
All right, no problem. If it works, we'll put it on the repeat so you can just get more.
All the best.
Okay, bye.
So 9:20 on Wednesday the 1st of July. Hi Kevin,
Hello.
we're in here today, come on in. Yeah, have a seat.
Thank you.
How are you?
Okay. I mean, it's a bit status quo-ish, but
Yeah.
certainly the anti-sickness tablets are working
Good.
to a degree.
Kevin came in to see Dr. Watson a few weeks ago and presented with a collection of symptoms.
So you mentioned a couple of things on the phone. You said you were quite worried, particularly about headaches and about your weight.
Yeah. Well, the nausea and the headaches and just a general feeling of something wrong here.
And so my colleague Dr. Watson had referred him into the hospital for some urgent investigations to try and find out why he'd been losing the weight. So you saw Dr. Watson a couple of times, and she's referred you to see this hospital, is that right?
Yeah. She referred me to see a stomach specialist.
Yes.
I saw a registrar last week.
Oh, you've been seen, okay.
So I've been seen once. They actually called me in.
Mm-hmm.
So that was a quick appointment.
Yeah.
And he's booking me in for an endoscopy and a scan.
Okay, so
Just to
a
be
camera
safe.
test to look down? Yeah. Okay.
Yeah. 3rd of July is the pain clinic
Okay.
second assessment,
Yeah.
which I think is looking at the stimulation.
Stimulation things, yeah. Okay.
7th of July, first appointment for physio, which is here.
Right.
So, yeah, I guess my main concern is CT scan results at the
Yep.
moment. Yeah.
So should we start with that bit?
Okay, thank you.
Let's bring that one up. So kind of going through it.
Okay.
So basically there is a little bit of change in this part of the brain, okay, and that shows that it looks like it's what's called ischemia, which is when the blood supply to little bits of the brain hasn't been great,
Mhm.
and so little bits of the tissue have kind of died, okay?
Mhm.
But it's really small little areas, and they think it's related just to really tiny blood vessels, but they can't see anything that's particularly concerning, so they can't see an area like a stroke or a tumour or a bleed or anything else like that, which is fine.
And is this going back? What sort of period? Do they know what sort of period these changes may
So
have
that's the
happened?
real problem, is that they can't work out when.
Right.
This could have been there for 2 days, it
Years.
could have been there for 30 years kind of
Yeah,
thing, and really, from what they see.
Okay, so really I just wait for the next...
Mm-hmm.
So I'm interested to see what the pain clinic come up with.
Yeah.
I'm still, very fatigued, very, dizziness, tiredness, all the rest of it's all still there.
Okay.
And no matter what I take, that doesn't go away. So, with this all part, this
Yeah.
underlying stuff. It's,
Okay.
yeah.
Let me have a chat with Dr. Watson and kind of think things all through and see whether there's anything else we need to be doing
Mhm.
whilst we're waiting for the hospital
Okay.
appointments, and then I'll get back to you if there's anything else I think
All
we need to
right.
be doing.
All right, lovely. Thank you very much.
All right. All right.
All right.
Okay, take care,
Thank
Kevin.
you.
Bye.
Okay. Do you mind if I just touch that?
It's tender.
It feels like it's migrating between the teeth, and sometimes if I put a bit of pressure here, it seems to relieve it. It's a nagging and gnawing pain. I've had so many x-rays, all around the head, everything.
I'm a complete loss. Those little bumps are a bit of a mystery, but I'll give you some treatment to
don't
try
worry,
and...
I'm full of mysteries. I've got glaucoma in one eye only. That really puzzles them.
Hello. Hi, I'm Dr. Chana. Come and take a seat.
Thank you.
Right, what can I do for you this afternoon?
Well, there was an email that went round at my school yesterday saying that there'd been a boy at school with slap cheek syndrome. So I'm quite pregnant, and I did some reading, and I think it would be worth me having a blood test done to check about immunity.
The email that's been sent round, was it just by the head teacher or was
No,
it by
it's by
the
the
public
medical-
health?
it was by the medical centre
Yeah,
at the school.
just wanted to make sure because
Yeah.
sometimes, you know, it can be sort of Chinese whispers.
Oh, yeah, no,
from
this
mums,
came from
but this was from the
medical
sort of
head,
health. Yeah. Okay. And any symptoms you feel well? I mean, obviously you're pregnant. How many weeks are you now?
23.
Okay.
23.
Slap cheek syndrome is a viral infection which is very common in children, and it can occur in adults too. Caught just like the common cold, and it's spread in the air when patients cough and sneeze. Slap cheek is a problem if you are not immune, and in pregnant women that have not encountered the virus, it can cause an increased risk of miscarriage in early pregnancy. So do you know much about slap cheek?
I did some reading last night, yeah.
Well, for people that are pregnant, so most people are actually, it's a virus, so most of the time you're immune, but you don't know because we don't really check for immunity.
Exactly. It's not.
Okay,
not
so
when
you probably, as a teacher, you might have come across this before without ever knowing.
Possibly, yes.
And as you said, it causes miscarriage in the first trimester.
Yeah. So obviously past that.
And you're past that, so in some ways it's good.
Yeah.
Because you know the risk is even less. So the main symptom that you will get is a rash.
Yeah.
And you haven't got a rash
no,
at the
I haven't
moment.
Got a rash,
Good.
but I did also read somewhere that 20 to 30% of people who get the virus don't have a rash.
We can do the blood test, which I can give you a form for, and you just need to go and get the blood test done.
Okay.
Okay, so this is the form.
Okay.
The result will come here.
Okay.
I will put a note on the screen, normal. So you can just ring up on a Tuesday or a Thursday. It takes about 3 to 5 days.
Right.
If it's abnormal, then I'll speak to you and we'll decide what else I need to do. But let's just put fingers crossed that it's all fine.
Yeah.
And that
So I'm
you're
guessing
immune.
in this one, normal is if I'm
Immune, yeah. All right.
Thank you so much. for
That's
your help.
okay.
Very good.
So we just give us a ring once you've had the blood test, and we can just tell you whether you're immune. All right. Thank you. All right. Bye bye.
Had it when I was little.
You probably are. I think most of us are immune to a lot of these things. If you've been around children a lot, you most likely are. But let's just check. All right. Bye bye.
I'm sorry, I've been away, so I haven't had a chance to look at it. I apologise. What I wanted to do is talk to you about your blood tests. Because remember, we did all those tests.
Yes.
Now, interestingly, your folate level is a little bit low. Now, folate can be reduced when you're on those medicines that you're on. So some of the epilepsy medicines can reduce your folate. I would suggest we start giving you folic acid to take in order to increase your levels.
Yeah.
So that way, hopefully, your symptoms will improve.
Okay.
Yeah?
Yeah.
That was a nice, easy one for me.
What's the quantity of folic acid?
So it's just 1 tablet a day. I'm giving you 5 milligrams of it.
And now is Ramadan started, and I have to fast like 2:30 in the morning, and till 9:15.
Gosh, yeah, it's a long day, isn't it?
It's a long day, but in my medicine, they took four times a daily.
Is there any scope with regards to your medicines? Are you allowed to take your medicines just with a small amount of water or anything like that? Would that be allowed? Because I'm very worried that you'll end up having a seizure if you skip your medicines.
Yes.
I think it's really difficult for a GP to deal with patients whose religious beliefs can put their health at risk, but my main role is to advise them in appraising the risks and the benefits, and mainly to support them through it once they've made an informed decision.
This is
there
very
any?
hard.
I know. Is there any way you're allowed to speak to like your imam or anyone like that to see whether it would be for medical reasons, whether it would be something you can?
Yeah, in medical reasons, they skip the fast, but
you don't want to skip it. Is that what you're saying?
I don't want.
I suggested Usman speak to his imam in order to get some religious guidance as to whether he may be exempt from fasting, as there are certain medical parameters by which you may be allowed to not fast and either make it back up later on in the month or pay a certain amount to a charity. Do you think maybe there'd be any way that you'd be allowed to just to be able to take your tablet?
No. because my fast is breaking. Either.
It's tricky because obviously I'd love to tell you I think you need to take it because you're going to be in a lot of pain and it'll be quite hard for you. But obviously for religious reasons I completely understand if you don't want to. But I guess that gets left in your hands.
Okay, I will think and saw my situation.
See how it gets on.
Yeah.
I was mainly worried by the end of the consultation with Usman because he is lowering his threshold for having a seizure and he'll also be in a lot of pain because of his spasms. But essentially it's his decision to make. See how you get on, but yeah.
Let's see.
Let's see. That's all we can do. I really hope everything goes okay.
Thank you.
That's all right.
Yeah.
Okay, take care of yourself. Bye.
Bye.
There we go. My pleasure. And I'll make sure I'm ready next time. Lovely to see you. Take care. Bye-bye.
Thank you very much.
Brilliant. Okay, nice to meet you. Bye-bye.
And I'll see you next Wednesday.
See you next Wednesday.
Take care.
Okay.
All
right then, bye-bye.
Bye. Oh, yeah.